Today's class is appendicitis. Before going to our topic appendicitis, we will go through the anatomy, physiology and applied anatomy of appendix. The vermiform appendix. Appendix is a finger-like projection in the cecum. It is a vestigial organ. The base of appendix is marked by McBurney's point. It is the junction of the lateral 1/3 and medial 2/3 of the line joining the anterior superior iliac spine and the umbilicus. McBurney's point is the classical site for tenderness in appendicitis. Appendix is also known as abdominal tonsil. It has 4 layers: 1 serous layer, 2 muscular layer, 3 submucosal layer and the 4th mucosal layer. The submucosal coat is very rich with lymphoid tissue, so it is also called as abdominal tonsil. Blood supply to appendix. Arterial supply. 1. Appendicular artery. It is a branch of lower division of ileocholic artery. Inflammation of the appendix will cause thrombosis of the artery. This precipitates gangrene of the appendix and ultimate perforation. 2. Accessory appendicular artery. This is a branch of posterior cecal artery. This artery should be properly ligated, otherwise hemorrhage will continue even after appendicectomy. Venous drainage of appendix. Appendicular vein drains into ileocholic vein. Ileocholic vein drains into inferior mesenteric vein, which becomes a part of portal venous system. Various anatomical positions of appendix. 1. Retrocecal position. It's seen in 70% of population. 2. Pelvic position, seen in 25% of population. 3. Subcecal position, seen in 2% of population. Subsplenic paracecal paracolic position, each seen in 1% of population. Functions of appendix. The lymphoid follicles present in the appendix helps in the maturation of B lymphocytes. The number of lymphoid tissues in the appendix varies with age. The lymphoid follicles are few at birth. An increase in number, that is about 200 follicles between 12 to 20 years of age. Decreasing in number, about half by 50 years, almost absent by the age of 60 years. Congenital anomalies of appendix. 1. Agenesis or absence of appendix. 2. Duplication of appendix. 3. Diverticula. It's very rare condition. 4. Left-sided appendix, which is seen in case of situs inversus. There may be transposition of thoracic and abdominal viscera. Then the appendix is seen on the left side. This is a picture showing different types of duplication of appendix. Type A, that is single cecum with one normally localized appendix exhibiting partial duplication. B1, you can see 2 appendix located symmetrically on either side of the ileocecal walls. In B2, you can see one appendix arises from the cecum at the usual site and the second branches at varying distance along the tinea from the first. In C, you can see double cecum and double appendix. This picture shows diverticula of appendix. Appendicitis. Definition. Inflammation of appendix is known as appendicitis. A picture of inflamed appendix. Classification of appendicitis. According to onset, it's of 4 types: acute appendicitis, subacute appendicitis, recurrent appendicitis and chronic appendicitis. Classification according to pathophysiology. It's of 2 types: 1. Obstructive appendicitis and 2. Non-obstructive appendicitis. Etiology. A. Obstruction of the lumen. That means the obstruction in the lumen, obstruction in the wall or obstruction from outside the wall. First we will see obstruction in the lumen. Fecolith or hyperplasia of lymphoid follicles causes obstruction. Other causes are intestinal worms, vegetables, fruit seeds, barium from previous X-rays, etc. Fecalith is also a cause for obstruction. Fecalith is composed of insufficiented fecal material, epithelial debris, bacteria, and calcium phosphate. Its presence in appendix is an indication for prophylactic appendicectomy. Second one, obstruction from outside the wall. Example, abdominal adhesions. This is seen in patients those who have undergone open abdominal surgeries. Third one, in the wall. Stricture or neoplasms. Appendicitis in middle-aged or elderly, presence of carcinoma may be suspected. B. Diet. Incidence is high in those eating rich fatty food with meat and fish when comparing to those eating simple diet rich in cellulose. According to pathology, appendicitis is of two types, obstructive appendicitis and non-obstructive appendicitis. Now we will see each in detail. Pathogenesis of obstructive appendicitis. There will be obstruction of the lumen, which will cause increased intraluminal pressure that will induce ischemia, which favors the bacterial proliferation and that will cause inflammatory change in the appendix. Types of obstructive appendicitis. It's of four types. 1. Acute obstructive appendicitis. 2. Subacute appendicitis. 3. Recurrent appendicitis. 4. Chronic appendicitis. Acute obstructive appendicitis. Obstruction is the major cause for acute appendicitis. There will be distension of the appendix due to oversecretion of appendicular mucosa. That increases the intraluminal pressure to about 50 cm of water. The distension will stimulate the nerve endings concerned with pain. Rapid multiplication of the resident bacteria of the appendix increases the distension, hence the pain too. Subacute appendicitis. Some episodes of acute appendicitis apparently subsides spontaneously before they reach acute stage. This is called subacute appendicitis. Recurrent appendicitis. In recurrent appendicitis, the appendix turn into a gambler precipitating attacks known as recurrent appendicitis. These attacks are usually milder. Chronic appendicitis. Some pathological examination of the appendix may reveal thickening and scarring. Patients with chronic appendicitis often complain of persistent right lower abdominal pain. The resected appendix may show fibrosis of the appendicular wall. Non-obstructive acute appendicitis. The inflammation starts in the mucous membrane or in the lymph follicles. Gradually, inflammation spreads to the submucosa. The appendix becomes red and congested. If the end artery is involved, its lumen will be thrombosed and localized gangrene will appear. As there is no obstruction, there is no distension. But when serosa is involved, localized peritonitis develops and the patient complains of pain in right iliac fossa. Course of acute appendicitis. It may end in perforation, gangrene, fibrosis or resolution. This picture shows perforation in appendix. This one shows the gangrenous appendix. Thank you for watching. See you in the next class. Take care. Bye bye.